Primary challenges that women with VWD face today, and I would say women and menstruators that face today, can be kind of grouped into two categories. One of them would be prior to diagnosis and then after diagnosis. I think main challenges to getting a diagnosis is really having that opportunity for someone to investigate further and actually follow up with the test and get a diagnosis. Many women and menstruators can go years and years and years with symptoms and quality of life being affected and lots of challenges that they face in their everyday, impacting their work, impacting their personal lives, their family, their children, and no diagnosis gets made. A primary challenge for that is even just getting the diagnosis. Once a diagnosis is made, I think the primary challenge is having it been taken seriously and having it feel like it actually, maybe it's mild, maybe there won't be this significant bleed, but it is affecting quality of life. It is still affecting things greatly. What can we do about that? A main goal is to start to make sure that there is education and support and knowledge around what is available to women and menstruators with VWD. I know for us at Hemophilia Ontario, we're always really trying to make that a priority, ensure that we offer up those opportunities to say, here are some things you might want to talk to your hemophilia treatment clinic about. Here are some things you might want to consider that can actually help your quality of life, help manage, and even just validating the fact that these things are a challenge for women and menstruators with VWD. Again, there's a lot of misconception around the comparison for women and menstruators with VWD versus maybe historically what we'd be seen as men as hemophiliacs. The attitude is that men with hemophilia are very severe and it's taken quite seriously. There's no questions asked when they go in and have a medical need or a bleed that needs addressing. But for women and menstruators, to navigate the medical system is a much greater challenge. Often when they enter a medical space, they're asked, what is even VWD? And what do they, that they don't really know what they're supposed to do with it, even in lots of different medical spaces. So the disparity is that VWD is not well known, it's not well understood, and then the historical bias that women and menstruators wouldn't have bleeding disorders is also stacked up against those who try to seek access to care or treatment. So I think bridging that gap of understanding, I mean, it's only been recent that we started to even start to reframe women and menstruators who have hemophilia as no longer being just carriers of the hemophilia gene. And I think that as we get more along and more further down in the journey of really making this well known, more education, more support, more treatment, then it will be, I think, a better situation for women and menstruators in the system when they're trying to access care. I think another thing that comes to my mind is the severity. Everybody defines severity differently. So if a bleed is very severe and life-threatening, that is well known to be severe. I don't think anybody would disagree with the severity of that. But where does the severity definition lie if you are in bed for 4 days because you can't leave the house, because you can't be away from a bathroom? Where does the severity lie in terms of those equivalents to quality of life? And I once had someone say to me that, women and menstruators have a guaranteed bleed once a month, but that's not really taken into consideration because it's deemed a menstrual bleed. So it's not actually seen as a bleeding disorder bleed, despite the fact that it actually, in terms of quality of life, certainly lands that way. So diagnosis for women and menstruators with VWD, I mean, a well-known statistic, I think was done, I think the CDC is about a 16-year delay. In my experience working with Hemophilia Ontario and the women and menstruators in our community, the delay is much greater. women and menstruators are not deemed as having a bleeding disorder. So there is an automatic bias historically that goes into they don't have that. Women's health care, as a rule, has been somewhat not a priority in the medical system in comparison to maybe hemophiliacs or men in the medical system. So I think we have a systemic sexist bias that exists in a patriarchal medical system. I think that also heavy menstrual bleeding comes with a great deal of stigma. No one wants to talk about vaginal bleeds. It's uncomfortable. We don't want to discuss it. It doesn't matter who you talk to, it's shied away from. And I think that not enough questions are asked, and heavy menstrual bleeding is somewhat of a core symptom for women and menstruators with a bleeding disorder, specifically VWD. Well, I hope a symposium like this will contribute to a broader understanding and education for what women and menstruators actually experience with a diagnosis of VWD. There can be lots of different understandings about what living with VWD might be like. And I think that it's always a positive to come together, share the research, share the understandings, collaborate with others, but also understand the patient experience. Because while it may look like it should look on paper, that doesn't necessarily mean that's how it looks in real life, an actual living experience. A couple of key thoughts that comes to mind from what I will be highlighting today is certainly this challenge of getting a diagnosis, right? The challenge absolutely is very difficult to get a diagnosis because there's a process. It has to go through your primary care provider, and then there's a referral process. And having that process, often primary care providers don't understand necessarily a great deal about bleeding disorders. The knowledge is limited, and then you add in the menstrual stigma and you add in the bias that exists around women in VWD or women and menstruators with bleeding disorders, that they don't have them, and we create a lot of barriers to diagnosis. So that's a key takeaway, and certainly one that I myself at Hemophilia Ontario is really engaged with trying to find some inroads to reduce that delay. I think another key takeaway is that a diagnosis doesn't just mean, whoo, everything is better now. We've got the diagnosis, life is great. That's not what it means. I think that a key takeaway is that a diagnosis still means a great deal of challenges. Women and menstruators still have to navigate the general medical system, the emergency room, the primary care provider. So even though they now may have a hematology clinic that understands them and they finally feel heard, there are still these challenges in navigating the medical system at large. And then the last kind of key takeaway that I think is really important is this treatment piece and quality of life. Oftentimes, the treatments that are available, women and menstruators with VWD are unaware of. They don't know what's out there for them to potentially try. And then when they do try them, lots of times they are hormone therapy. And if a few goes at that doesn't work, specifically for heavy menstrual bleeding, there's a tendency to give up and say, it's not working, I guess this is just it, which means that impacts their quality of life and impacts everything. So I think getting engaged in the things that can be done and starting to move things forward. In my experience, sometimes when I propose something we try, it's met with that's never gonna work. And we have to try. We have to keep, just like this symposium, moving things forward and pushing that conversation. So one of the things I'll be bringing up is a number of initiatives that at Hemophilia Ontario we're working on. And I like to say not if they happen, but when they happen. So I would say that's part of, we've got to be creative. We've got to find other ways to make care and treatment more accessible and better for women and menstruators with VWD.